if you wouldn't mind please introducing yourself and talking a little bit about the Alliance.
Yeah, my name is Jen Black, and I'm the Executive Director of the Alliance of Southwest Missouri. And we're located in Joplin, Missouri, and we serve 4 counties down in the southwest corner of the state, being Barton, Jasper, Newton, and McDonald counties.
Great, thank you. Can you talk a little bit about how the Alliance has responded to COVID? And please provide us with some examples of how it's affected your existing programming and how you've adjusted.
Yeah, so the main focus for the Alliance is really we work on prevention and safety of kiddos and kind of surrounding the family and keeping them healthy. We do a lot of work with substance misuse prevention, child abuse prevention, like car seat safety, fire safety, and all. And so immediately we turned our focus to social media and all things technology. And of course, I'm of an age where that's a little more difficult. And so trying to figure that out. But thankfully, we were able to secure some young people that had a great knowledge with social media, and we've learned a ton. And so we started different campaigns that would get in front of kids, parents, and just the community as a whole. And then also a lot of our programs, we just had to take to Zoom. So our parenting class, we had 2 parenting classes in session when we had to start working from home. So immediately we moved those to Zoom, and thankfully most parents were able to figure that out and continued in their parenting class.
Great, thank you. So can you talk a little bit to, or in more detail, about your shift in social media use?
Yeah. So prior to COVID, we had our Facebook page and we had Twitter that we used sometimes. And so we immediately started an Instagram account and a TikTok account. And so, you know, there are different demographics that interact with each of those platforms, but we wanted to make sure we were interacting with people. And so we were able to take the new campaigns that we developed during COVID and apply those on social media. So for example, one of the things we did was the gratitude challenge. And it's been scientifically proven that if you write down 3 things you're grateful for a day for 21 days, it changes the neural paths in your brain and you think more positively. And so knowing that we were all kind of isolated in our own homes and the mental and emotional battles that would come with that, we wanted people to focus on things they were grateful for. So we did that on Instagram and Facebook. And as the Alliance, we posted 3 things a day, and then quite a few staff members participated, and then community members then participated as well. And so it was really just trying to get people to think more positively in a time where we really could have melted into the couch, I guess.
Right. So it sounds like you had a quick pivot for your programming and thinking about your clients and their families. Would you mind sharing a little bit about how your staff responded, how as a leader you responded to your staff and some of the adjustments that were made to make it possible for people to keep working?
Yeah. So when I started noticing that the NBA was making changes and Disney World was closing, I thought, oh goodness, we're in trouble. And because those were big companies that were going to sacrifice a lot of income and making huge changes. So thankfully we have a sharp IT contractor. We contract with a great company, and I was able to get a hold of them, and they already had us set up in a lot of ways where we could work remotely. And so probably 2 weeks before I had to send everybody home, I had them in working on our laptops, making sure our printers would be able to go with us and all, and they had us in good shape. We had to secure Zoom accounts. We had to secure a couple hotspots for people that live out of town or out in the country. And we had a trial run or 2 with Zoom meetings. And so the staff did pretty well. Of course, when we started our staff meetings on Zoom, I was pretty sure we could start a new sitcom just from all the errors and hilarity that took place. But they quickly adjusted and got used to it. We started checking in. I checked in with staff twice a week, which is very unusual to have staff meeting that frequently. But I was worried about mental health for my staff, and a little less worried about productivity, but we still had to make sure that we were making all the adjustments to justify a full work week. And, as everybody found, it's easy to do laundry or get a Netflix show or something in during the day while you're working, which is perfectly fine. It's no different than standing at the water cooler and having conversation. But helping each of them say, okay, here's what I'm responsible for. Here are the people I serve. How did I do that in a technological world versus in person? And so quickly that conversation changed to, okay, once we do go back to the office, how do we continue? Because I think COVID has changed the way we do things forever. And so I think if we don't keep up with technology and that way of learning and working, then we become irrelevant. And so that's still an ongoing conversation that I'm having with the staff, making sure that we are tapped into technology in a way that is relevant to our clients.
What did you see during this period that I guess is ongoing?
Right.
Right, in terms of the biggest challenges for your families?
I think for our families, our biggest concern was just that mental and emotional piece. So that they're home full time with their kids. They now have new responsibilities, not only just in childcare, but feeding them but then they became teachers and educators. And then they also had to fight the battles of, no, you don't get to go play with the neighbor kids, or a lot of friends of mine have teenagers, and I started thinking about if I was a teenager during this time, I would have been terrible to live with because I'm very social and want to be out with people. And so I watched them fight with their teenagers about trying to keep them home. And so it just elevates everybody's emotions. So you start worrying about domestic violence and substance misuse and child abuse. And so that's really where we tried to hone in on. We partnered with all of the restaurants that were doing drive-through and carry out, and we provided drug disposal bags that they could then give with their takeout bags. And the point of that was so people would take them home while kids were home more and had more access to the medicine cabinets, that they'd be able to get as many prescriptions or over-the-counter drugs out of reach and be able to dispose of them properly. And so that's another angle we looked at. We started a parenting during the pandemic class per se. We did it, it wasn't a curriculum necessarily. It was a time for parents to get on Zoom together with a licensed counselor and just talk about what they were seeing with their kids and help them identify the emotions their children were feeling and give them tools to respond to that, and then how to manage their own emotions. So hopefully we would prevent some child abuse that would happen. So those are all kind of things. We tried to do our distracted driving via Zoom. That didn't take off because it's either a 4-hour class or a 6-hour class. And for a teenager to sit down in front of the computer for that period of time when they don't have to, parents didn't feel like they would participate. So we didn't do that. So again, some of our programs just had to stop.
So sorry to jump around for a little bit about this, but when it comes to social media and your adding of new tools like Instagram and TikTok, will you maintain those? Have you learned something that will let you continue with that kind of those tools?
Yeah, absolutely. We are going to continue to use the additional social media platforms that we have taken on during the time of COVID. And that kind of plays into keeping up with technology and the times. And so Instagram hits a different audience than Facebook does. And TikTok is even a complete different audience than either of those. And so the trick is when you work in the field of prevention and safety, how do you make a TikTok video that kids want to watch or interact with when you're trying to educate them? And so sometimes that's tricky. And so you have to get really creative because you have to somehow be cool enough for them to want to watch it, and then be very strategic in your messaging. But that's a challenge that we're going to continue to fight and be a part of, because it's one way to get in front of them.
So this is a question that we didn't talk about on Monday. So if you don't want to have this be potentially part of it, I'll just tell Parker to take it out.
Okay.
But so I just thought of it listening to you talk, and as a partnership that focuses on safety and prevention, largely around child abuse and neglect, there's been a lot of conversation over the last 6-8 months about the inability of the system, the way we had it structured, to see those kids who are at risk. As an expert in that, what have you learned? Like, what have you noticed? Do you feel like abuse has gone up and that the system isn't, the way it was structured, isn't responsive? And what can be done for that?
Yeah, absolutely. I think that is true. We're now finding out that abuse it got really quiet for quite some time, and not many reports at all. I think it was more than 50% less calls and reports than normal. And that's alarming and shocking. I mean, it makes sense because the kids aren't at school, so there's not as many eyes on the situation, or outsiders that are seeing the results of that. And so that was very alarming. And then once people started interacting with kids again, those reports shot up. The thing that was most concerning that I heard, both from Child Services and our Children's Center, is the abuse was more grotesque, and the age of the child being abused was much lower than normal, much younger than normal. And so that just breaks my heart and makes me sick to my stomach, of course. And so that's one conversation that we had a lot during this time, is how can we create programs or ways to interact with kids for neighbors to be able to see if a child's riding their bike down the road. And I think once we got past the fear factor of COVID, where people felt a little more comfortable knowing that they could get within 10 feet of a child and still be safe and not, pass the virus, then we went and we were creating ways for kids and families to be outside more. So take your sidewalk chalk out and do the stained glass challenge. And that's one thing we didn't get done, but we had talked about, is having them submit pictures. And so just finding ways for neighbors to pay attention without having to be within 6 feet of the child.
Yeah.
It's still a concern, especially, as things have spiked again. And so we really did more education on ways to interact with kids and things to look for, versus go knock on the door and, ask if they can come play. It's just making them more aware of what was happening.
Right. So you mentioned the drug disposal bags through takeout opportunities.
Mm-hmm.
So my follow-up question for that is, did you already have relationships with these restaurants, or has that been part of the COVID experience to build some new relationships in the business and other communities, mm-hmm. service communities?
No, COVID has definitely allowed for us to develop some new relationships. Of course, we have our go-tos, or people that have participated in our program prior to COVID. But what we did is we really got online and just found out who is still open, who's doing drive-through. And we tried to focus on locally owned places as well. There was a meme that went around and talked about how you've asked us for donations for years and years, and now we need your help to stay in business when you think about small business and locally owned businesses. And so we wanted to honor that because it's very true. We do knock on their door regularly. And so we tried to identify them and then take them to their locations. And then we advertise that as well, that help drive business to those locations. So definitely there have been new relationships built due to COVID because of the kind of work that we had to do.
So that leads to, I think, what is my last question or last topic I would like to talk about for a minute. And, you know, it's, we're not done yet, right?
No.
We probably have a few hard months ahead of us. But one thing that, you know, it happens in any you know, historical shift there are lessons learned. You know, there's the ability to sort of look back and figure out how we adjusted and what worked and what didn't work. So what are you seeing, and what do you think you'll carry forward?
Like I said before, we're definitely going to continue with social media, all platforms, even, you know, with all of the shift, even with the politics and the disunity in the country and all of the new social media platforms that are popping up because of that. We're already investigating those to see if it's something we want to be a part of. And so just keeping our finger on that pulse, making sure that we're staying culturally relevant while we do this work. And I think it's easy to become outdated faster than you even realize. And so trying to stay focused on that. We did some videos with licensed counselors just to encourage people, again, focusing on mental and emotional health. We will probably do that more frequently because there's going to be, I think, a long period of time where people are still struggling from just this major adjustment. And, you know, with COVID, I think one thing that media is not talking about, and we're not talking about in conversation, is the fact that so many people have passed away. I mean, we're talking about that, but we're not talking about their families. So, you know, say 50 people pass away in your town. If you multiply that by 10, you're looking at 500 people that are grieving. And that's going to change the face of the world because that's happening all over. And so I think grief on top of fear, on top of whether you have to battle the virus yourself or not, we're looking at mental and emotional health issues for quite some time. And so we will continue to focus on that. We'll continue to probably put those videos out just to help encourage people. We will continue. We had coloring sheets made specific to age groups with encouraging messages in them. We're still holding on to those, that we'll do coloring contests and anything we can do to plant that positive thought process. We'll plan to do another gratitude challenge, you know, just helping people, very simple, easy things you don't even realize that's helping your mental health. And we'll continue to put those things out. If we do have to shut down again and we're quarantined the way we were at the beginning of this, we will do everything we did then, and plus add to, as far as parenting during the pandemic classes, making sure that we're giving resources and tools to parents that are very tangible and easy to use.
Okay, very good. You had mentioned that there has been some language that has come out of this pandemic moment that you think is going to be useful down the road.
Yes. So one thing that I think that's kind of cool that has come out of this is the term flatten the curve. And so we've been in the prevention world for some time, and now the whole world understands flattening the curve and what it might take to prevent something from growing or exploding. And so I think for nonprofits and human service organizations that do this on a regular basis, we now have a new terminology and a new language that the whole world understands. So if I'm looking at child abuse or substance misuse, and I can use that term, let's flatten the curve because here's what could happen, people are going to understand, and probably they're going to understand quicker, and then they're going to know how to respond to help prevent that.
Right.
And that's a stance that, as the Alliance, we live in this prevention world. And, whether we agree or disagree with wearing masks, or whether we agree or disagree with closing down our business communities, whatever, the reality is we have to stand on the pedestal of prevention no matter what. And so that's the stance our organization has taken with COVID, is we're going to do everything we can to help prevent it from being spread to others.